to go to the X-ray room to help transfer Mr. Ivory from the table to a gurney. Mr. Ivory has suffered a cerebral hemorrhage 6 days ago and has paralysis on his left side. You will be transferring him from the X-ray table to a gurney with the help of 2 other technologists.
Before we transfer you, okay? Your left side is paralyzed, so I'll put it for you. Can you put your right hand over on top? Perfect. Alright, ready?
These X-ray techs are going to transfer this patient from the table to the gurney using a slide board. Now what they're going to do is they're going to roll the patient onto his or her side, stick the board underneath the patient, put the patient back onto his or her back on top of the board, and on a count of 3 they're going to pull the patient over onto the gurney.
Perfect.
That's locked, right?
Yes. Alright, ready? 1, 2, 3.
How's it going, everybody? I'm Alfredo, and my partner AJ here. We'll be demonstrating a transfer of a patient 4 days post-op of a hip replacement, wheelchair transfer to the table. So stay tuned, people. Here has had surgery of her right hip. She's had a right hip replacement, I believe. So what you want to do is you're going to bring her in at a 45-degree angle to the table, strong side to the table, so the left side closest to. We're going to go ahead and bring her in. 45-degree angle. Left side. Make sure you lock your wheelchair so she doesn't move and potentially hurt herself even more. What we did do is, before we came in, we went ahead and lowered the table to just make transfer, speed up the transfer, make it a little easier. Make sure your tube is out of the way so she doesn't hurt herself. So carefully, you lift up the foot pedals here and allow your patient to do as much of the transfer as she could possibly do while it being comfortable, and then go ahead and assist further on from there. So Miss Ivory, are you able to scoot up to the front a little bit and help you out here?
I think I can.
Alright. Here you go. You can go ahead and grab onto my hand if you like. So you can go ahead and establish yourself a wide base as well. You can go ahead and turn around and lay on down. There you go, perfect. So you're just gonna go ahead and lay on your back, head that way. Take your time. And if you would like, you can assist holding on to her back as well. Maybe lifting up if she needs help. Doing okay? Alright. And that's the patient transfer.
For this scenario, you are in the X-ray room. A technologist has asked you to get Miss Roberts out of a wheelchair and onto the table using a step stool. The patient has an injured left knee and the table cannot be lowered. Once the exam is done, you must now get the patient off the table and back into the chair using the step stool. The patient was brought at a 45-degree angle with the strong side facing the table. Now what we have here is an injured left knee. So Tim here, he's going to assist the patient onto the table using a footstool. The table cannot be higher or lowered in this scenario. So here we go. There we go. Just gonna pivot around.
Put your hand right there, sir.
Where? Alright, we're just going to get you to put your head down. Sir, I'm going to help you up. Alright.
Now,
With the exam completed, the patient will sit up, take a breath, get all dialed in. Then Tim's going to come on over and assist the patient back onto the wheelchair, making sure that the wheels are locked and everything's secure. The patient will sit back down into the wheelchair.
You doing okay? I feel a little dizzy. Alright, take a couple breaths, I've got your back.
Good job, Tim. You gave the patient some time to recuperate.
I feel a little better? Yeah, I'm good. Alright, you're good? Okay, I'm gonna rotate you around.
Watch the steps go. Can you put that close to this? Thank you. And you can go ahead and grab onto